Good morning, Councillor Collins.
Good morning, sir.
We've talked a lot about this concept of pro-patient before. I hope you don't mind me saying, but you are super pro-patient.
Thank you.
Can you tell us about some of your work?
Yes, I'm a borough councillor and have been starting my 22nd year, although in two tranches, so 12 years in the first tranche and now coming up to 10 years in the second tranche. A lot of that time has been spent either on social services committees connected with health as well, or on scrutiny panels, and I'm the current chair, as we speak, of North West London Joint Health Overview and Scrutiny Panel.
And what sort of work have you done in terms of being a pro-patient over the years?
I have been the advocate for the voice of the people at scrutiny level. People over money has always been my goal, and they're not savings, they're cuts. So when people talk about saving money, they're talking about cutting services.
So I know you've been active in terms of healthcare for all, and particularly healthcare and access to healthcare for the visually impaired community, being visually impaired yourself. And this is really, very high level, political sort of work you've done. Do you have any advice for people who want to engage in pro-patient work and what they could possibly get involved in?
Well, my first advice is to look for a patient's forum or a patient's voice. That's a good way if you're coming in from the health angle. Sadly, today the only other way of doing it is to join a political party, to go independent. Yes, there are independent councillors, but to join a party and to build up your reputation within the party. But much more important than that is what I've done over the years, is I've built a rapport with my community.
And I think you have joined Health Shared and will be making content and sharing it online. Can you see this as a new era in terms of being able to do things without so much infrastructure, potentially from your own home, sharing your experiences?
I do, but the danger of that is whilst connecting with folk through video links, through online links, there's nothing better than to be able to speak face to face to people in a group.
Absolutely. All right. Well, thank you very much for your insight.
Thank you.